Thanks for joining NCS webcast series. Today is our first webcast about the mix of healthcare. Together with me, I have Jim Lin, our healthcare sector lead, and Danielle Ng, our healthcare enterprise architect. We're also very honored to have Mr. Tu Chin Seng, Fellow of Advanced Computing for Executive and US School of Computing, to join us later at the panel discussion. We've entered the second half of 2020. While we have been slowly reopening the economy, there's no doubt that COVID-19 has shocked the world, especially our healthcare system. In our point of view launched in early June, we have talked about using three lenses, including freedom, security, and touch, to view digitizations in the post-COVID-19 world. Each lens has articulated the challenge and the key considerations. For example, in the lens of freedom, we're considering the constraint that we face during lockdown, yet we have found a new set of freedom and choices that we may not have considered before. In the lens of security, we've considered the adaptability of solutions to new challenges, protections of enterprise assets, including data, and ability to continue and provide consistency of service level. In the lens of touch, we have discussed the spectrum of touch, from high touch to low touch, and even to zero touch. Also, we have talked about empathy and community. We will launch an articles on the mix of healthcare and zoom in into the challenges the healthcare industry face and the opportunities that we have seen in healthcare and its systems. So our healthcare systems were overwhelmed. The limitations on healthcare resources and increased exposure to transmissions were huge problems that we have faced. The immediate challenges is how to handle the surge of patients into the healthcare facilities with the limited of trained healthcare professional available. What about the capacity of the hospital and infrastructure and the supply of personnel protections equipment for our healthcare workers and masks for our citizens? In the article, we have suggested a few key digitizations focus for healthcare organizations, including automations and artificial intelligence for clinical decision support systems, telediagnosis and telemonitoring, and robotic for contactless patients monitoring, geolocations, next-gen tracking tools, video analytics, and facial recognitions for virtual quarantines. Without further ado, I'm going to introduce Daniel Ng and hand it over to him for his presentation.
Let me start through the first lens called retain freedom. Why freedom? Because healthcare institutions in the battle with COVID-19 have experienced some tremendous strain on their resources due to the sudden surges in patient loads. So what that does is they are actually not able to service the patients as usual because they are spending a lot of resources dealing with treating the virus and containing the virus. So it is actually imperative to explore how technology and solutions can optimize operations and resources to concentrate on delivering such critical services. So it is that freedom to continue to service the patients in the best way possible, especially in critical healthcare. So what do healthcare institutions actually need to do in this area? Firstly, you can deal with managing the demand. And how do you do that? You do that by prioritizing and right-sizing care to ease the acute healthcare service demand. So what that means, it could be via a portal, via engagement method like an application. Your patients or potential patients can actually log in, input their symptoms and input their condition and what they're feeling into the app. And the app, based on AI, based on past records or history, will give them a certain percentage certainty of the condition that they may be experiencing and redirect them to the correct healthcare resource, and which may not always be an acute hospital, but it could also be primary care. In this way, it lowers the demand of the patients that jam up into emergency rooms or emergency departments, right? Another way that healthcare institutions can explore solutions in this area will be to augment their workflows and systems with AI and automation. So let me give you a first example for automation. So for automation, it could be menial tasks that you normally have to manually key in information, for example, from one silo system, let's say a hospital information system, into another system, which could be a reporting portal for the ministry. And you could use robotic process automation for the fields that can capture the fields from the source system and automatically transfer it over to the reporting system. And this is even more efficient because there's no human error involved, because they will copy the information over from the source system to the destination system. One example of how AI is used in healthcare to improve systems could be through the use of diagnostics. So you actually employ higher level diagnostic tools where AI can analyze X-ray images, or AI can analyze conditions that people are inputting into electronic medical records and making better sense of the thing based on historical and new guidelines and the clinical protocols, and recommend treatment to the doctor, of course, as a decision support. But the doctor, of course, has the last say, as the critical decision making is actually done by the clinician. So AI is not here to take away the decision making of the doctors, right? Another aspect that you could look at in healthcare for the freedom aspect is providing mechanisms for the staff who actually do not support the patient's front end, or do not come into contact with the patients. They could be back office and corporate staff, or could be contact center staff. So what happens in this case is they will, like most people who are not offering essential services, may be operating from a work from home arrangement. And what happened, if you've seen in COVID, was that the arrangements became ad hoc, and there was maybe not ideal infrastructure to support this work initiative. So moving ahead, we see that these freedoms to run virtually or work from home perspective could be semi-permanent or permanent. So you need the correct infrastructure to secure the information and to support this information. Secure in the sense of patient confidentiality, and also in terms of commercial information which you may not want to leak. That security aspect will be further explored with my colleague Jim in the later section, right? So how you retain this freedom, these are some suggestions that NCS is proposing or suggesting, and you definitely need to do certain things like accelerating your investments in new technology and the supporting infrastructure to maximize all this productivity and efficiency. It also drives the digitalization of healthcare services to a great extent that you would not have seen before COVID. And you obviously have to build platforms that allow service delivery to scale beyond the healthcare institution, as you are supporting services that may be beyond your premises in the terms of the remote care and in terms of supporting the corporate initiatives like the work from home. Thank you. That's the first lens. The second lens, which I'm going to talk about, is touch. So it's about rebalancing touch. Healthcare institutions should explore solutions on how to find the right balance between high-touch solutions, high-touch in the sense of continuing to engage their patients in their interactions with the institution, and zero or low-touch solutions which have emerged due to the need to minimize the risk of virus transmission in the course of operations, right? So what do we need to do in this area then? So you're putting in solutions to do the enforcing of physical distancing, looking into minimizing and tracking contact points between staff, patients, and contractors and visitors in the following areas. So areas like patient visitor registration, temperature screening, and staff security access. You may have installed devices to monitor and register patients as they go through, or visitors as they go through security points, or even into registration points into your hospital or your clinic. And you can have all this all in one solution that actually monitors and tracks and identifies these people who come in to the institution, and also even with even if they're wearing face masks, it can correctly identify the people and take the temperature. And also other low-touch solutions in the sense of for staff security access, which normally will be used biometrically, for example, with either your finger or other access methods through your staff pass or contact card. But in this new sense, you could be using technology like facial recognition, which should be accurate, and also touchless, because you want to minimize the need to come into contact with physical surfaces which may be infected with virus, right? So another area to look at in terms of touch is patient triaging, remote care, and vital signs monitoring. So you could be using low touch solutions in sense of remote patient triaging. Telehealth in last few years has been more basic kind of teleconsultation, which is through a video consultation, but this has limitations in the sense that you can only diagnose certain conditions with this video consultation. So telehealth has advanced in the last few years to include new solutions that can come with instruments to further diagnose, or for the patients to self-diagnose along with the teleconsultation, putting instruments to measure certain vital signs or certain aspects like heart rate and other signs, so that the doctor on the other side of the remote call can make a better call on the condition. And this means with greater sophistication and advancement, you can analyze and diagnose more conditions remotely than before. And this is helps to minimize the need to go into the hospital, which is in a sense you're trying to allow them to have, or rather patients who may not want to step into a clinic or hospital to expose themselves to germs or viruses, right? Allowing in the same vein, using a remote care in this way, you can allow patients who are high risk, like elderly and seniors, who may high risk to the virus, you can allow them to see the doctor through a remote consultation. For example, residents in a nursing home, they can use teleconsultation and remote care for the doctors to continue to maintain that high touch, to maintain that contact and engagement with them via the camera and with the assistance of the nursing home nurse, of course, and to further catch up on their condition. And if they would need to order medications, these could be delivered rather than making the nursing home make arrangements for physical transport and to bring these patients to the hospital. So this also has a cost savings, plus it maintains a high touch engagement with the patients. Another aspect also for touch could be remote vital signs monitoring. So instead of in the daily course of a patient, you will know that they will normally measure the patient's vital signs like blood pressure every day and every few hours, in fact, through a physical machine where the nurse will bring to the bedside to monitor or to put on the cuff and to measure blood pressure. But with new technology, the vital signs monitoring devices have gotten much more sophisticated, and you can actually do this remotely. So you can have it's not really a camera, but it's a line of sight device which measures maybe up to 5 different kinds of vital signs, similar to how an ICU would work, but through a remote device without a physical person to go inside to maybe potentially expose themselves to germs or viruses. But now the nurses can actually do it from a remote location. This also helps if you're monitoring conditions of, for example, a community isolation facility like what we have in Singapore at the Expo. Another area for looking at low touch solutions could be contact tracing. So by having all this trackability and traceability, which I mentioned earlier at the registration points and staff security access, you could use video analytics and camera to trace the paths of people who have gone through your institution, whether it's visitors or as patients, in line with other systems in the hospital, like the visitor management systems and the contact tracing, other systems that they have, to monitor the path of where people have gone through, to trace the patient's journey within your own institution. And this will actually help greatly reduce the time needed to trace potential patients who may need to be quarantined due to exposure to the virus, right? So in this way, we're talking about incorporating new technologies such as robotics, contactless, biometric, and monitoring sensors, video analytics, and AI-led modeling in patient journeys and operations. This also similarly requires an investment in scalable infrastructure and platforms to support all these technologies. Let me run through one example that we have in NCS that you may not normally associate NCS with these new remote technology, but we have a research and development team that's working on robot health manager to do monitor visitor and crowd screening. So we have robot prototypes, and together combined with sensors to form the act of actually potentially identifying patients of high risk in crowds or in visitor crowds. So they can detect patients who are running temperatures, or through the gesture of having standing there, we can different sensors to sense whether they are coughing. So in line with a sound sensor and a gesture sensor, you could monitor that this person is really coughing, and whether his temperature sensor is high, so he may be running a fever. And this together, you can make sense of all these things happening and know that this patient is actually potentially not well and could be a potential infected patient. So remotely, the robot can actually navigate through the crowd, identify for the nurses or for the healthcare workers to quickly isolate the person from the rest of the crowds to prevent further spread of the disease, right? So this is one of the examples that NCS is looking into, and is to show you that we are looking into new solutions to deal with a post-COVID world.
Thank you, Daniel, for giving the hope to companies to achieve freedom and be able to conduct business in a post-COVID world. And thanks, Daniel, also giving the spectrum of touch so that the different companies knows that they need to reinvent themselves to know at which level or which spectrum of touch they need to engage their customers, the employees, or the partners on. Now let's look at the last lens in the post-COVID world. That is the lens of security. COVID-19 in itself is a threat to our health. But in the course of fighting it, new security threats and risks have surfaced with the increased deployment of different technologies. The technologies that Daniel has mentioned to you, like AI, robotics, biometrics, right? There are different types of technologies being used to achieve freedom and reduce touch, right? There's also many sensors being deployed, right? Whether is it for contact tracing purposes or is it for other different purposes. And there's this term called IoMT, Internet of Medical Things. It is actually stemming from IoT, Internet of Things, which actually illustrate a connected world. In the new post-COVID world, there will be more and more connections. There will be more and more connected devices forming like an IoMT, Internet of Medical Things, right? Although all these technologies, sensors, and devices give you the freedom to reorganize your business and to reduce the physical touch while increasing the emotional touch, right? This actually poses risks and security threats. And furthermore, as we have heard from Esther and Daniel, there are going to be more endpoints functioning outside the enterprises due to the decentralized workforce, right? And all these endpoints, more endpoints outside the enterprise, technology, sensors, devices, they are all going to present opportunities for hackers to exploit, right, if these are not secured. And with more activities moving online, security will be the highest priority for many organizations to operate in the post-COVID world. And this is what we call the new normal. So just a side note, right? Actually, there was a report saying that the healthcare data is worth 100 times more than the e-commerce data. So you know how worthy or how expensive the healthcare data is. And that's why security is of utmost importance for any healthcare institutions and healthcare providers. So what do healthcare institutions need to do in this area? First of all, of course, they need to secure communications and information exchanges, including machine communications. We are very used to human communication or human to machine communications. But as I said, it is going to be a connected world. You are going to have an IoMT, Internet of Medical Things. That means medical devices are connecting and talking to each other without human intervention at some times, right? So the machine communications, you need to also secure it, right? That's why there are many initiatives either by the public sectors or by the different healthcare institutions to look at security at different layers. Second thing that the healthcare institution needs to do is definitely data security. As I mentioned, healthcare data is worth 100 times more than e-commerce data. So that's how hackers will want to hack into your systems or hack into any healthcare provider systems to get the data. It is worth a lot of money, right? And we have seen and we know of certain healthcare data breaches in the past, right? And that's why there are new operation center like ASOC, Advanced Security Operation Centers, that NCS is building with public health providers in securing the data of the patients. The third thing that the healthcare institution needs to do is actually something very different. Ensure physical and mental security and wellness of the healthcare workers. We all know that healthcare workers are stressed and strained mentally and physically in this COVID world, right? There's actually a report. In China, the study found that the patients who are quarantined, right? And we are not even talking about the healthcare workers, just the quarantine patients, they are more than 28% of them having a trauma feeling, right? When they are staying at home, working with the kids. And another report shows that 1 in 4 Singaporeans indicated that they are not in good mental health, according to a Ipsos study during the circuit breaker period. So you can see that even the people who are the patients or people who are just working from home, their health, the physical and mental health is already at stake. Imagine the healthcare workers who need to work in a high risk areas like in the isolation ward or in healthcare facilities, and they still need to go home, right? For those who doesn't need to quarantine, they still need to go home to be with their family. They have long hours. So all the physical and mental stress and strain is going to potentially cause security breaches. I'm not saying that the healthcare workers will intentionally do it, but their mental health, the state of the mental health and also the physical health can potentially lead to errors. And the errors can cause or can invite security breaches or hacking by the hackers. So these are the important areas the healthcare institutions need to look at, right, when it comes to security. So how do we, or how can anyone help to restore security for the healthcare institutions? I would say that instead of looking just at technology, we'll need to put in place a robust information security strategy. And this strategy will include many different layers. First of all, of course, is your technological layer. That includes the infrastructure, right? It can be the network connectivity. So there are people who are looking at high speed network connectivity, but at the same time, it has to be very secured, right? And of course, applications, right? In today's, in Singapore healthcare, there is quite a few of cloud access to the applications. And we all know that cloud, when it first introduced, there were a lot of security concerns. And again, cloud security remains a very popular topic even today. So the network connectivity and the applications, where most of them are on a cloud basis, we need to look at how to really secure them, right? The infrastructure is very important. And of course, another thing is communication channels, right? According to, I think, the market report, there's a 300% surge in volume of people using Zoom. Right, Zoom is just one of the many communication channels that people are using during COVID, and it will continue post-COVID world. Right, there are many other like MS Team and some others. So how to ensure secure messagings in these communication channels will be of utmost importance, right, in a post-COVID world as well. So apart from the infrastructure of connectivity, applications, and secure messaging, the second thing that we need to look at is really the governance and processes. So many companies or many organizations, even the government, have BCP, Business Continuity Plan. And as part of the BCP, it has its own security plan and policies that can safeguard the data, safeguard the communication, and safeguard the organization, right? But again, I think from the COI report that was published in the past, having a governance and the security policy is important, but at the same time, the enforcement and the actual execution and monitoring and control of it is of equal importance. So I'll say that this is another very important thing to restore security for organizations, to formulate a business continuity and security plan according to the references and experience from COVID, because again, every pandemic is different. COVID is different from SARS. So whatever we have from SARS, SOP and BCP are good, but they serve as a reference, and we need to adapt it in a new COVID world, right? And the last thing that I'll say is digital identities. So we are going digitalization, right? Or digitization, no matter what you call it, right? And in the healthcare, like what Esther and Daniel mentioned, it's going to be a mixture, a hybrid model of online and offline patient journey, right? You probably want to do a lot of online appointment booking before you go to the healthcare provider, whether a polyclinic or hospital, because you do not want to expose yourself to more risk by waiting there for a long time, right? So there's an online and offline patient journey with a handover, right, from appointment booking to actual visit. And of course, with the introduction of teleconsult or telehealth, which include teleconsult and telemedicine, right, you need to have a seamless online and offline journey. And this handover and handshaking potentially can create challenges or security gaps if they are not handled properly. So I would say that digital identities, which can include tokenization, blockchain, or some other technologies, to look at the entire seamless online-offline journey so that the handshaking and the handover doesn't create more gaps where you can invite more problems or threats coming over. So I will conclude that as what Daniel has mentioned, right, in a post-COVID world, NCS actually recommend, right, the healthcare providers to look at 3 lenses: the lens of freedom, right, which actually allows you to have control of your own patient data potentially, and also the telemedicine and telehealth; the lens of touch, where you need to have a different spectrum of touch for different services within the entire patient journey; and the last but not least, the security lens, which again, once you have freedom, once you have the different spectrum of touch and you want to have a wide range of choices, the security will come in wide ranges as well. And you need to tackle that carefully. With that, I thank you for listening to our webcast. I will pass on to Esther, who will organize and moderate our panel discussions.
Thank you, Daniel and Jim. Without further ado, let's start our e-panel discussions. Right. Let me reintroduce Mr. Tu Chin Seng, NUS Fellow of Advanced Computing for Executive School of Computing. Chin Seng is an experienced senior technology executive with more than 33 years of experience working in Asia Pac, in China, Middle East, and USA. So today we're very honored to have him to join as our panel discussions with Daniel and Jim. Thank you.
Thank you.
Welcome, Chin Seng.
Thank you.
Yeah, so let's start our discussions, right? We have just heard Daniel and Jim has talked in depth in terms of the 3 lenses that NCS has defined for the COVID, the post-COVID world, right? What are some of the other lenses and area that future of healthcare may encompass? So maybe Chin Seng, therefore, from a research and academic point of view, what are the key interest area that you see?
Yes, I think Jim and Daniel alluded to that, right? There's lots of information that healthcare generates. So we normally will group it as confidential. But look at it, the more information that you have on the patient, the better we can treat. So we are not talking about inventing, we are talking about supporting. So one of the lens that we want is the lens of insights, the lens of intelligence, the lens of augmented knowledge, right? This is something that NCS has done very well because under their portfolio, you have things like the government knowledge of implementation from SingPass information to the income tax to the Ministry of Finance. These are very important because the COVID told us that without money, the patient, the population will be in trouble, right? That's why there's a lot of injection of money. So it leads to the second thing that we are talking about in healthcare is how do we create funding mechanism to the poor, to the disadvantaged, to the person who's at home. So other than information, which is to know the patient, to know the population, we have to have the lens of finding a way to fund the patient, to fund the citizens, to fund the population. And the third lens that NCS to have is that you are in the business of population mobility. Let me explain to you why. In population, we have people living, people working, and also people doing their own entertainment. For this to work, the facility, the transportation has to work, right? So in healthcare, the patient has to move to the hospital to look at, to find his consultant. The doctor has to find a way to see the patient without the patient coming to him. So this is the issue of mobility or an issue of logistics. So one of the research that we are doing is to understand how do we use the logistic model to help the patient to move away from his place of residence to hospital. Today, that journey can be long because it could take him a few hours because he has to wait for the Grab vehicle, which does not have a wheelchair facility. So you got to call another Grab vehicle that has a wheelchair facility. Or he has to go to the outpatient at the hospital and wait about a few hours before his appointment comes about. So these are mobility issues that NCS is more than adequate to tackle. And this is a lens of moving, right? So there's a second lens, the third lens that I'm talking about. And the fourth lens that you could have under the whole auspices of NCS is the lens of putting everything together. Remember, the facility and infrastructure is one of the most important thing for urban user like me, like you. So we need to book a Grab. That's one thing. That's easy. Now, but we also need to know whether when I go there, do I have a caregiver following me? If I'm in the hospital, who do I inform to visit me? Who will pay for the bill, right? So this is the whole of government, the whole of population. So NCS is in a very unique position of merging the two together so that we can work easier. We can be informed when our loved one is in hospital or they are delayed. We can let the old elderly know that they are safe because their treatment is well planned, and when they go there, it's only about a 10 minutes wait and they will get treatment, right? And this is missing today because Singapore, as efficient as we are not integrated to help that patient, to help that citizen, both as a worker, both as a patient, and both as a population. That means he's retiring like me at home now, and how do I know the information you have? I hope that helps you.
Thank you. So you have mentioned about the customer side or the patient, from the patient point of view, right? So from a customer lens, right, how they accept the new normal and future of healthcare. So maybe we pass this to Jim. Do you have a point of view on how does this impact the patient's point of view?
Yeah, sure. Maybe before I answer that, I want to just add on one point to what Chin Seng mentioned, right? So we have many lenses, and I think Chin Seng introduced another 4 lenses. I will actually kind of want to introduce a lens, although it's kind of partially covered in some of the lenses already, but I want to single it out, called the lens of care, right? So we're talking about healthcare here. We're talking about freedom, we're talking about logistic, we're talking about touch and many other things. Just like a spectrum of touch, I think we need to have a spectrum of care as well, right? Especially we're in healthcare. So a lot of things today are still focusing, right? Whether is it COVID, pre-COVID world, during COVID, or maybe even post-COVID world, a lot of focus has been on the primary care, right? And we're trying to minimize the touch when people go and visit a healthcare institution. But I mean, outside Singapore, especially in China, Japan, and Hong Kong that I know of, right, there is a lot of long-term care facilities that are being built, and home remote care, right, home-based care or community-based care that are already there in these countries, right? Singapore is moving towards that, but not really there yet. And I think that this lens of care is very important to look at the entire seamless care from primary care all the way to the long-term and the home-based care, right? And of course, there are technologies also are going to be useful for this long-term and home-based care, right? Such as a lot of the remote monitoring and all those things. But we don't see a lot of integration of, let's say, your electronic medical records that is hosted or housed in the healthcare providers, whether is it public or private, to the people at home. So although under the lens of freedom, we talk about the consumer need to own or have their own healthcare data, it is not really happening as full as yet, right? Because of course, these are sensitive data and we do not want to put in the hands of consumers who may not know how to handle them properly, right? But this is a trend. If we look at the trend now, apart from all the digital transformation that's happening in the healthcare providers, there's this thing called consumerization of healthcare, which exactly is like the consumerization of transport when Grab and Uber came into picture, right? This consumerization of healthcare started with teleconsult by many of the companies today. In Singapore, you have Whitecoat, you have Doctor Anywhere, and so on and so forth, right? And even medicine delivery, right, is done by some of them. But what is really lacking is a remote diagnostic capabilities that can enable a more end-to-end view and control and enablement of the patient journey. So I think the lens of care is important. And of course, another part of lens of care talks about actually adaptive learning, right? Because you want to care for people like your healthcare professionals who need to learn how to fight the new COVID world, right? And how to operate in the new COVID world. But everybody is at different stage of learning, and everyone has different maturity level. You cannot have a simple home-based Zoom learning and expect everybody to learn there. Some people are better off learning face-to-face, right? So adaptive learning, I would classify it as part of lens of care as well, that you need to look after the people who are contributing to the healthcare services. Yeah. Okay. So that's yeah.
Let me add on to what Jim says, and what Chin Sing has mentioned. So, what Chin Sing has mentioned very important, the financing portion of it. See, the reason why, in a sense, remote care or community care has not really taken off in recent years in Singapore is there's a lack of a funding model. So there must be a financial model to support these new kinds of care for it to be supported. In the US, right, there are actually examples where they're actually funded by the payer scheme. So because it's a private healthcare system, the funding comes actually from the payer. The insurance payers actually controls the money. So they fund the scheme and they even fund the medication and the whole scheme. So it's privatized. But in Singapore, actually, there's no such, or rather the payers are not empowered as such. So there's a need to look at how to change or enforce or support the model, maybe from ministry or from industry perspective, to support this going forward. Another thing about home care, the elderly care, is also the acceptance of the technology. You know, elderly are some of them are not. A lot of them are not, probably not very tech savvy. Maybe our generation, by the time we get there, will be more acceptable to such technology. But to ensure the high level of, let's say, the high touch engagement, right? You've seen some examples in the other countries where they use the seal. Remember the Japanese on the seal where they can engage the thing, or telepresence robots with the faces of people who are familiar, or recorded voices of the relatives who are actually engaged. So those things are attempts to be more engaging, to keep them engaged. Why it need to be engaged? You see, what happened was we realized that in the COVID was elderly care, right, services were actually suspended during COVID. So what happened was they were not able to go to their daycare centers and in order to continue their engagement, daily engagement, to keep their minds active. So it's quite a challenge for them in the last few months. So coming out with a solution to address that, to give them, because some of them, they need to be engaged and it keeps the mind healthy, keeps the body and mind healthy. It's not just about the body healthy, but someone to talk to, someone to react to. And so solutions in that area are actually also need to be looked at further. So that portion of the care, it's not just about a system, but it's about the care.
Great, thank you very much. Then I think we have, throughout our conversations, we have also touched on to the different data, or devices that collected data, right? So I think and Daniel, you have also mentioned that sometimes data can be very sensitive, right? And to the point that it gets to the security part, Jim has also highlighted this concerns, right? But I think that for the data, it has been deemed as the new oil, right? For different industry. And so maybe I would like to ask, maybe Chin Sing, do you have a point of view of how does healthcare can utilize the data or be able to exploit the data part to better serve the patients?
Allow me to work it from the weakness point. So healthcare data under confidentiality become very enclosed. So one of the things that Singapore has, which many countries doesn't have, is our ability to aggregate EMR data and the NEHR data. And this by itself is very confidential, but that is the irony of it. For our population model to grow, we need to mine this data and create new insights where we can help the patient. So the data as fuel for the elderly at home is one to say that this is what you are under the population model. This is how your treatment is done under a medical model. And this is how the money that you are going to get, because the government is funding you, because you don't have a job, you retired for 20 years. So the data has to help the patient, first of all, to get care. Second is to get him the best care in terms of what analytics can give him as a presentation to his care provider. And the third, which is very important, is that he as a patient should feel safe. So just now Jim mentioned security. Yes, I received a phone call. The phone call says that the Chinese custom has a package on me and I will go to jail. Imagine now a person call him up and says that I'm from a medical institution and you are dead if you do not pay me a certain amount of money. So this kind of security is very, very concerning to elderly, right? He not only need to be funded, but he needs to be protected. So the information that we have, that Singapore has, which we are not utilizing, is the huge information on data at rest and data emotion. Data emotions are data that we have on patient of how long it takes for him to visit the doctor. How long does it take for him to wait? What kinds of drugs that he does, and whether is he compliant, meaning that does he take his medicine, right? So all these are information that we need to get in order for the data to get the patient well. Okay. The second data that we have that the Ministry of Health and the private sector will want is that they want data to be aggregated to be relevant. Okay, so I have a patient walking in. The first question that comes to me is, are you a chest patient? Okay, then you will say that, okay, what is your medical condition? Do I have a So this information, if you see in today's data world, it is not together. But if I have it together, the moment the patient comes in, I know that he's diabetic. I know that he needs certain treatment. I know that last 2 weeks he was complaining about his chest pain and things like that. So the second data is healthcare professional data, right? We are going to augment medical data with motion data, with moving data in order for us to help the doctor. So now the GP is in a different position. He knows that the patient is coming to him with certain precondition. He knows that he's coming in that he is a chest patient or in terms of funding, or he knows that he doesn't have a caregiver, he's living alone, right? So these are all information that is gold to the patient, but it may not be gold to other people.
Yeah. Maybe let me extend a little bit from what Chin Sing mentioned on data, right? And also to address customer lens or customer point of view questions. So data, right, is very good. And with all the big data analytics for the past few years, right, it's supposed to actually be more targeted and more personalized. And of course, with data, nowadays we talk a lot about AI, right? So AI started many, many years ago in the 50s, but it didn't take off because of the limitation in computational power, algorithm, as well as the availability of quality data. So now we have the data, right? And you have AI, which can help. So AI is used in many areas in healthcare. It can be in AI in clinical and pharmaceutical trials, right? Where you actually can reduce the error rates, right? Even in COVID-19, I believe many of them are using AI, which of course based on data, right? To do a lot of trials so that you can get a new vaccine or the medicine, right? And of course, AI is also used in improving the accuracy and reducing the workload of people who huge amount of data, especially all the scale. All these technologies are good, right? As a patient, these are good. And the data and the AI are really good. But what does it mean to me, right? I hope that with all this, it can actually lower the cost of healthcare, right? I don't need to pay so much, but if still doesn't lower, so you can introduce the best technology in the world. You can have the most accurate data. You have the best targeted, personalized medicine, care, and whatever. But if I still need to pay the same amount of money, what is this technology bringing any good to me as a patient? So I think this is from a patient/customer lens. They'll be very concerned about what can this technology really bring or benefit me.
Coming to the point on the data, how it's being secured, there are some examples in overseas. So for example, I know in NHS, they actually use blockchain technology to actually control the security of a personal health record. So for example, if you're trying to assess a physician, for example, not in your hospital, is trying to assess your record, they actually send a notification to the patient that this doctor, for example, is trying to assess your record. And only when the patient gives the go ahead gives the approval that they can access his EMR record. So there's actually some I think they're using blockchain and NHS for this particular portion. So it's like patient control record. So there's one use case that actually they have implemented in NHS. And regarding data also comes in many dimensions. It's not just for the patient themselves, but in my earlier discussion with the lenses, I was talking about how they optimize operations. So you're looking at data also helps you to analyze to predict demand, because that's also how you optimize your resources. Meaning by knowing the spikes and the troughs of how patients come to your hospital during seasonal periods, for example, flu periods, or even certain things, I mean, COVID notwithstanding, but traditionally there are certain periods that people fall sick more within the year, then you can adjust and operate around there. So for example, if you know that there are more people coming in, your staff more people, is how you stagger your resources to support this. And this actually may actually save you some money in the long term, because you don't use up all your facilities at one go. You might actually section off only those areas that need to be used by people coming in. So you can actually have some cost savings, and hopefully, like what Jim said, it may be passed on to the consumer, because then they will have some savings that they won't spend so much on energy or facility. So data also feeds into the other part about the recent spate of healthcare institutions or building campuses. So smart campuses are being built across the nation. So Novena Health City, Woodlands, SGH, the Outram campus are all areas where they're looking into all this. So they're looking at the data also to feed in how they do the non-clinical aspects, which is your logistical aspects, whether to send robot deliveries or unmanned vehicles to do deliveries within the estate or even within the compound through the service tunnels, doing things like analyzing all the operations or even the laundry and other aspects, even the food, where the smart food delivery through robots and the whole engagement through sensors and all that. So where NCS actually could play is more in the areas of what Jinsen said, what we are strong in traditionally is known as systems integrator. So these are systems of systems. There are so many sensors, there are so many things that are going to come in, but surely you're not going to look at 20, 30 different UIs to manage this whole thing in your hospital. It's going to be really difficult. It's going to be very hard to manage. So combining this information through a common platform and to manage and make insights of it will be actually very beneficial, very useful. And I see that it's a way going forward that is probably will happen. Whether you manage robot resources, human resources, anything that relates to automation, or even every aspect about facilities and building management within the campus will be looked into in this way. And that's what I think is going to be one of the future directions, if not current directions, that people are looking at in the long run. Yeah.
So if I can contribute, if summarizingly from the healthcare point of view, right, the first data will be extending the patient information. So Jim mentioned about the sensor, about the IOMT. So we will see more of these home devices. The second data we have is data regarding the patient in terms of a medical condition, right? So you have the sensor data, you have the medical condition. So these data are used by the GPs, used by the hospital primary care. Then after that, we have the data within the hospital itself, right? How they manage. And within the hospital, you can use logistic SCM management optimization system. How do you optimize your goods, your patient flow, your waiting time, your resources, your beds. And then we go into population health, right? In population health, we will say that, do we cite major hospital systems, or do we cite decentralized pharmacy, right? Just now you mentioned about logistics to do robots. Now we have this problem, right? I have a wrong package being sent to me today. So in medicine, you cannot have a wrong package, right? So we have to talk about security of 100% accuracy and correctness. And the last data that we want to have, which will save a lot of costs, is that if we understand the movement of patient, we understand the aging and the disease pattern of the population, and we understand the capability and capacity as we have seen in pandemic, then we can now not only plan for future load, but we can optimize for current load. So optimization save costs, and optimization not only save costs in financial, but also save costs in time and frustration. That's to support what Daniel is saying.
Agree?
Thank you. Thanks for the point of view on that. So maybe there's a based on the conversations, right? I've also captured that at the very beginning, Chin-Sing, you have mentioned about the mobility part, the population of mobility, right? And that will be involving the activities that outside of the healthcare systems, right? There's how do you bring the people around it? And it seems like a touch on the ecosystems of supporting the whole healthcare industry also, right? With that, other than transportations, right? Do you see healthcare will be working with other industry closely in order to strengthen and the industry to support if there's any major events happen like this, or to the extent that it's really about our future of healthcare, right?
The biggest pandemic Singapore is facing other than COVID is the aging pandemic. Okay, so let us use that as a discussion point. So the first ecosystem that we have to encompass is the ecosystem of caregiver, both your children, my children, but that's easy, right? Then we have the ecosystems of friends and the community. So we have your social group, we have our own kaki, mahjong kakis per se, right? Who supports you. If you don't show up tomorrow, they will call you because you are sick and fallen at home. So this is very important. We've seen in pandemic, the charitable organization become a very important party to the pandemic team, correct? So they are not only supporting the patient, but they are supporting the healthcare worker. So we are talking about a new social physical structure. The second thing that appear is food, correct? We have our hawkers involved, but that aside. So in the population health, if you want to optimize the elderly care, the pandemic of elderly, then what will happen is that we have to talk about balanced diet. It's no point for him to have char kway teow every day and durian every night, right? He will be sick soon. So we have to talk about a balanced diet. So this is where information become important. We move. So mobility in terms of him moving out of the community. So it's not only for him to see the doctor, but for him to see his friend, for him to visit Haw Par Villa, for him to visit Sentosa, right? Today, that role has been played by the social charity welfare group. In the future, perhaps, with autonomous vehicle, perhaps we can make in such a way that by working with MRT, for example, right? The route to the end destination could be automated. Then we move up. You will find that more and more of us, 1 in 4 in the year 2030 will be very old, right? You and me. And what will happen here is that we will be controlling our finances like our CPF if we are conscious. So, but most probably we might have Alzheimer. Most probably we might not be as fit as we are. So how do we use the community to help us? So in this case, we have IMH who has this program for us to be mentally well. But we also have other charity groups, like the Brahm Center and things like that to help you. So how do we engage these people such a way that they can access your confidential data, because CPF information is confidential, at the same time helps you to live throughout your 20 years of rest of your life, right? So then the last will be that, you know that the first person that is caught under the government system is the police, right? So how can we now create a community role together with our paramilitary forces, our security forces, to make sure that our community is not only safe from criminals, but it's also safe from ourselves, because I may fall, I may get hurt, I may be disarrayed, and begin to kill people, right? We don't have guns here, but we do have knives. So what happened? So how do we create a community mental health? So many social, physical structure that we can create, which I think that NCS can do.
Yeah, maybe I add on to what Chin-Sing mentioned, right? Esther, your question is what other verticals or industry that healthcare will be connected to or relevant, right? So I think Chin-Sing mentioned about mobility, mentioned about transportation. That's definitely very important. But I always look at the healthcare, right? Not standalone, but as part of the smart city, Right. So in the smart city world, right, whether is it the report or the indices from Roland Berger or from McKinsey, right, they always talk about 6 or 7 key pillars, and at least 4 of them are about the same. One is smart healthcare, right? The other one is smart government, smart mobility, smart buildings. So these 4 are always there, right? And some will actually put in smart education, and some put in smart utilities, or somebody call it energy and environment. So all these are interrelated. You look at it for smart healthcare to work really smartly and to really benefit the patient, right? You have all the smart government, smart buildings thing, right? Which whether is it in a hospital buildings or at home, right? You have all the sensors, you have all the robotics that are working and helping, right? So that's really smart buildings, right? Automation, connected, well connected devices, right? So these two work hand in hand. And of course, smart government, right? Especially in countries where public healthcare, whether is it a healthcare financing is very important, or the public health is very important. So smart government, the ability to link all your, like in Singapore and like what NCS is doing, right? The importance and the ability to link the different government initiative or schemes, whether is it from CPF, the healthcare provider, or the different, or even GovTech, or even your insurance provider, right? Linking everything together through, let's say, a smart government initiative is also very important. Of course, mobility and transportation, I don't need to talk too much about that. Chin Seng already illustrated a lot, right? How smart mobility or smart transportation actually positively influence the smart healthcare or the healthcare to really work well together. And the last one I want to talk about is really education, right? As I mentioned just now, adaptive learning is very important. And no matter how much we can invest in the healthcare, whether is it a primary care or the long-term care, right? The public education is very important. And I believe at the very beginning, HPB, right, promoting health, is one of those institutions who is trying to do a public education in terms of healthcare and wellness, right? And this smart education, right, being able to personalize, right, whether is it use of AI, or to really do a lot of broad-based education and adaptive learning, will be very helpful to move healthcare into, rather than a sick care, moving to a healthcare and to health. That's why I think in the entire smart city context, you can look at smart healthcare or healthcare as a pillar among many other pillars.
Yeah. To add on to what Jim says, there's also the aspect about the social part lah. Because you realize long-term care, a lot of the problems with healthcare, with elderly and all that are not healthcare problems. Actually, psychosocial impact is very important, about the mentality, about keeping them well engaged so they don't have dementia or Alzheimer's or things like that. So that's why you see in other countries, I think it's also Hong Kong and other countries, the social ministry is the same as the health ministry. They're actually one ministry. They don't separate them out. So I would say that there will be closer collaboration between MSF, maybe, or maybe even eventually rebranding a social and healthcare ministry together, because there are aspects that you need to handle together, right? The healthcare, you guys, is to maintain health. How you maintain health if you don't even have people to talk to? You don't even want to live, that kind of thing. It's like, I don't have interaction with anybody. Nobody care about me. I suffer depression. So it's not just for elderly. Maybe it's also for the young. There's a support net. There must be a support net. It's not just about the IT, but also a support net that supports all these things across. So maybe it's also for this, and whether you can use data from social and healthcare combined to make sense and insights around here. So that's also another aspect that just like to highlight. It's not just about the healthcare part, but also the social part plays a very big part in that. Yeah, that's my view. Yep.
Great. Thank you very much. And I think the time flies, as I think we have reached our end of our session. Really, thanks a lot, Chin Seng, for your time. And also Daniel and Jim for holding the presentations and contributing. Right. And so we have got a lot of information today from the micro view on looking through the lenses for our healthcare industry, through the security, touch, and freedom. Right, and we also talk about the bigger picture and how do we actually collect the information through the IOMT, the terms that Jim has introduced, right? And all the way to the patient's data. How do we actually utilize it? How do we actually protect it? right? And there's a last but not least, the ecosystem was really an interesting topic. I think that one put in a macro view of how does healthcare industry that doesn't stand alone, but being a picture of a smart city, right? Which is absolutely a agenda for a country like Singapore that want to build our society to be there's a proven there's a and not just there's advanced in technology but proven for next there's a major event, right? And hopefully we will be more ready when we need to face the next major event. Thank you very much.